Good morning, everyone. Hey, I wanted to make a quick video talking about a topic that a lot of doctors ask us about. They ask us, they say, hey, do you have a video of like the normal flow in your clinic? I'd love to see that. How does that work? Well, unfortunately, we don't have a video of that, partially because of HIPAA compliance purposes. We could probably get a video like that eventually. We could find some patients that are okay with us videoing and they sign all the consents and the release forms and whatnot, and we could do a video walkthrough real time and explain what's going on at each department, each station in the clinic. But I figured I could just run you through that whole process too here. So whether you're seeing this on the Facebook Live or hearing this on a podcast in the future, I will try to be as descriptive as I can because I don't have any diagrams or pictures. It's just either looking at me or you're listening to my voice explaining the process. So I'm going to explain a typical visit of a patient who is doing corrective care in our office. Now, corrective care in our office is defined as follows. We are addressing segment, posture, and movement. Most of our patients, not all, most of our patients are candidates for traction, which changes the shape of the spine, and we follow chiropractic biophysics protocols for the most part. And they do postural corrective exercises to address posture as well. So that's shifting their body one direction, so statically, and then progressing to do that, shifting and holding that, shifting against resistance, so doing it with like banded resistance. And then the third progression in a postural corrective exercise is holding neutral, being pulled into their abnormal posture. So let's say that their rib cage is shifted to the left. We're pulling them to the left. They're holding neutral. They're watching themselves in a mirror, and they're combining that with a functional movement like a forward or backward lunge, for example. Okay, they're doing that for repetitions while they're holding their rib cage neutral because that person came in with a left thoracic shift. Okay, so that's the whole posture component. The segment component is how we practice. We practice Gonstead, so we do specific segmental adjusting. We have tons of doctors in our program that do not do Gonstead. We only have like 4 doctors in the whole program of almost 150 doctors that do Gonstead, so please do not think that is a prerequisite that you have to do Gonstead. You know, I'm biased. I think being specific and having a methodical approach segmentally is best, but you do not have to do Gonstead to do this. We have upper cervical doctors that do amazing work and etc. So, and then the movement component is functional movement. We measure movement, and then we have protocols that we design for the patient on a visit-by-visit basis for them to progress through. Do we map out, this is what you're going to do your first visit, this is what you do second visit? Not necessarily. It's kind of implied in our systems, and our exercise therapists follow a progression that we map out by just selecting what dysfunction we want them to work on with that patient. So for example, if someone has cervical and thoracic and shoulder dysfunction, that's D1, D2, D3 in our system. We have white belt protocols in all 3 of those. That means that patient is going to learn white belt protocols for cervical, thoracic, and shoulder dysfunction. And we have certain rules built into there as far as a hierarchy of what happens first, second, and third. And once they clear the white belt protocols, and then they can do a couple of other things that would qualify inside of that whole white belt category. Once they pass that, then they can test for yellow belt and they can progress up to the next level. They would clear yellow belt protocols for those selected dysfunctions, then they would pass baseline yellow belt criteria, then they would progress up to the next belt level, which is a blue belt. Okay? So that's how that works as far as the movement. So now I talked about segment, posture, movement. There's 3 different things we do. Now, how does this work when a patient comes in? I'm talking about a patient who is well into their care. So let's say they're a handful of visits into care. It's not their first, second, third visit. We have very special things we do on day 1, day 2, day 3. We have a couple of main things we do on day 4, day 5. Okay, I'm parking right now. So bear with me and see if I can park and finish this at the same time. What do you think? Well, so far I'm doing it pretty successfully. Okay. So anyway, how does a visit look like? Well, patients are in the office anywhere between 45 minutes and 90 minutes, really depending on what they're doing and how motivated they are to do it. for one. And what do they do on those visits? They come in, they check in at the front desk, okay? Ideally, they already have all their appointments pre-scheduled. They've already taken some sort of payment plan option, whether they make a single payment, so that's all out of the way, so they don't have to stop at the front desk and make payments each time, or they're doing some kind of like monthly or bi-monthly auto debit. Okay, so that's all handled. They're pre-scheduled, so they don't have to stop at the front and schedule out appointments because they already are scheduled. So those are those two things. They come in and they are sent back to the exercise department first in most cases. They start doing some spinal warm-up exercises. The exercise staff is in constant communication with us, whether my scribe, myself, or we send through a message telling them when we're ready to go, and then they will send someone from the exercise department over to get checked and adjusted. We have timers, so we're timing how long they're doing exercises for. We would then stop the timer. They would come over, get adjusted, and then they would go back into exercise. They'd start the timer again. They would keep going back into exercise. Once they finish exercise, they would go off into traction. If they're a candidate for traction, we have some patients that are not, so they are done now with all their exercise. They would then ice. It's a typical thing that we do following traction, is icing. Or if someone is acute or has pain or inflammation, we are icing afterwards. And then they just wave and say, see you later at the front, because they're already pre-scheduled and prepaid. So that's a typical visit in the clinic, is they're coming in, they're going to exercise, they're bouncing over to adjustment, back to exercise, traction. In some cases, depending on the schedule, we can use exercise as a buffer to make sure the patient's not sitting and waiting for prolonged periods of time. So sometimes they might come in, and let's say I'm super backed up, we had an acute new patient, I had to get someone else in. They might actually, if it's a more seasoned patient, they might do exercise, warm up, do traction first, see me last. So we can mix it up a little bit, but usually it goes exercise, adjustment, traction. It goes EAT, exercise, adjustment, traction, usually in that order, but sometimes it can be mixed around. So hopefully that brief description of, first off, we address segment posture movement, and then how a patient goes through that in a daily visit. Hopefully this brief description helps visualize that. We'll get a video up on that sometime soon so you can actually see it. But if you want to see the systems inside of our doctor training portal, we have a demo. It's a 30-minute pre-recorded demo. Go to demo.movenowu.com. You can watch it. You get some links emailed to you so you can watch it whenever you want. If you don't have 30 minutes right now, spend 10 minutes watching it. Jump in later. It's been really helpful. We've gotten great feedback from 99% of our chiropractors that say it really helps to have a demo like that explaining how stuff works, so that you know if you think this is a good fit for you or not. And then you schedule a call with someone on our team. We can talk to you about some of the specifics, find out more about how you practice, and let you know if we think this is a good fit for you. So check that out. I'm going in for a haircut now, and we'll talk to you soon.